Namaste. Dear friends, welcome to this special session of She and Rights being held during the 16 days of activism against gender based violence and ahead of the International Human Rights Day on 10 December and the Universal Health Coverage Day or UHC Day on 12 December. This She and Rights session is together hosted by Global Center for Health Diplomacy and Inclusion or Syyed, Women Deliver 2026, International Planned Parenthood Federation IPPF, Asian Pacific Resource and Research Center for Women ARROW, Women's Global Network for Reproductive Rights WGNRR, Asia Pacific Media Alliance for Health, Gender and Development Justice or APCAT Media, and CNS. CNS is also proud to announce that we are media partners of Women Deliver 2026, also of the 26th International AIDS Conference, that is AIDS 2026, and also of IAS 2027, the 14th IAS Conference on HIV Science. A few quick housekeeping announcements before we begin. Participants can please type in their questions and comments in the chat box even as the speakers present. We will take up as many relevant questions as time permits after all the speakers have presented. Let us take a moment to see the ground reality and let it sink in. There has been hardly any change in violence against women and girls since the year 2000, that is, in the last 25 years. Since 2000 onwards, the annual decline in intimate partner and sexual violence is abysmally low at 0.2%. This is really unacceptable. Also, let us not forget that while 165 out of 193 countries have domestic violence laws, but only 104 countries, that is 54% countries, have comprehensive legislative policies and laws in place. Or in other words, nearly half or 48% of the countries still lack comprehensive legislative policies and laws to address domestic violence. Even in those countries where laws exist, funding to address domestic violence is not adequate. Rather, it has declined since 2022. Moreover, all forms of violence against women, which also includes emotional and economic violence, are highly underreported. So, when we read that 1 in 3 women worldwide has experienced violence at least once in her lifetime, this is a gross understatement. Actual violence rates must be very high, which is very alarming and painful. If we are to walk the talk on ending sexual and all other forms of gender based violence, we have to translate words into stronger actions, dismantle patriarchy, and rethink and rebuild feminist health and development systems. WHO's Director General, Dr. Tedros, said a few weeks ago, violence against women is one of humanity's oldest and most pervasive injustices, yet still one of the least acted upon. No society can call itself fair, safe, or healthy while half its population lives in fear. Ending this violence is not only a matter of policy, it is a matter of dignity, equality, and human rights. With these thoughts, let me invite my friend, mentor, and guide in the development justice movement, Dr. Pam Rajput, to deliver her keynote opening address. Pam is a noted feminist and gender justice leader and currently serves as Emeritus Professor in Panjab University. She is also the former chairperson of Government of India's High Level Committee on the Status of Women, and perhaps one of the few we know who has played an important role at every Commission on Status of Women till last year. Welcome, Pam. Over to you.
Thank you, Shobha. Thank you very much. Well, let me first take the opportunity to thank the organizers, especially you, for organizing this event on a very, very pertinent theme, which you have really set the tone in your initial remarks. And thanks for inviting me to be valuable panelists over here. Now, given the title of our event, Why hardly any change? It is certainly critical to reflect as well as stress on advocacy for accountability. Let me preface my thoughts. Of course, you have shared uh, the data, but let me refresh myself by saying that we began with the second half of the last century, both globally and nationally, with two powerful words, with a syllable, of course: we the people, and with the thrust on human rights. We witnessed the adoption of Universal Declaration of Human Rights, and I'm reminded of our great lady from Gujarat, Hansa Mehta, who saw to it that both the preamble and the language of Article 1 of this Universal Declaration doesn't talk of men alone, but it talks of we, we, both men and women. And of course, we have had conventions on rights, civil and political, economic, etc., with reporting mechanisms. And the most important to us, the Convention on Elimination of All Forms of Discrimination Against Women, which also talks about violence against women. And thereafter, the last century also witnessed four world conferences on women from 75 to 95. 95 being the most important, the 30th anniversary of which we are celebrating, where in the platform for action we have 12 critical areas, which includes violence against women. And it is the same period, 2 years before this 95 conference, the United Nations General Assembly passed a resolution in 1993 on elimination of gender based violence, or violence against women, as we call it. And thereafter, many resolutions have been passed by the General Assembly, by the Human Rights Council, and reports also being brought out. But significantly, it was in 1991, we must remember, that it was the civil society actors who, at the Global Women's Leadership Institute, called for and initiated what we are celebrating today as part of the 16 days activism to end gender based violence. So it began, I want everyone to remember, as a civil society initiative, and that was way back in 1991. And of course, later in 2008, Ban Ki moon, the then Secretary General of the United Nations, started with Unite to End Violence Against Women, the words and the phrase which has been used by the current Secretary General also in his call to end violence against women. Hereafter, many resolutions and many reports have been, prepared and presented to the UN, and officially the UN gives a call for this 16 days of activism to end gender-based violence with a signed theme each year. This year, the signed theme is the digital violence, which is on the increase with the enhanced technology. But the question that is posed by the organizers of this webinar is, where are we? As far as where are we, I think Shobhaji began very well to give us the figures, but also the fact remains that given that violence against women and girls is a violation of human rights, and that it is rooted in gender equality and impediment to sustainable development, and despite all the decades of, whatever I've just called, the painful reality or the painful truth is that we are far behind from realizing the vision that there must be no violence, no thing. And of course, Shobhaji has, shared the data, but let me again say the latest report brought out by the Secretary General says that 840 million women are subjected to violence against violence. That is 1 in 3. And women has faced violence, which is double in conflict situations. Past 12 months say that 316 million women have faced physical violence or sexual abuse by the intimate partner, and 263 million women have faced that by the non intimate partner. 51,000 plus cases of femicide have been reported. And digital and technology violence, of course, facilitator has facilitated the abuse further, and which is the key theme of this year. Not to leave the parliamentarians, we look to that more and more women should be in decision making bodies, but are they free from that? No. The women parliamentarians, the survey has been conducted and says that 82% of the women parliamentarians across the region have reported some form of psychological violence or the other. And similarly, the journalists have also, suffered violence. 73% of women journalists are subjected to online violence. And not only that, 20% have also suffered what is called, offline attack by the forces which are, not pro women being active. So, rightly observes the WHO Director General Tedros that violence is one of the humanity's oldest and most pervasive injustices, yet one of the, as Shobha said, one of the least acted upon. Structural inequalities, time wouldn't permit me to go into the details, and I'll just use, the bare minimum language to explain. Structural inequalities, patriarchal norms, normalization of violence, consumerist neoliberal models of development, gender insensitivity of the enforcement agencies, be it police or the judiciary, have added to the situation. And under that, another important thing is that underinvestment is there in prevention. The international system too has failed. You know, we look to the UN, and we are celebrating the 16 days of activism under the UN banner. But the question arises is the international system too has failed. The UN has ceased to be an effective body, and I would like to be very frank in putting it a straight question. Does its writ in any case work, be it Afghanistan, be it Iran? Only yesterday, so much data of violence against women in Iran has come out. Does the writ of the United Nations run in these countries? And it's not these countries. I will ask, does its writ even run when, as far as the USA is concerned? USA has of date has not signed the human rights sorry, CEDA, which we call as human rights document for us. They have not signed CEDA. And unfortunately, and this is tragic, I would say, the 68th session of the Commission on the Status of Women, where we were expecting a political declaration, to be there. The political declaration did come, but what was going on behind the curtain? You know, the USA did not want the word gender to be in that document, and they agreed to that document word gender in the document at the cost of what? Our health organizations are a part of this meeting, and I'm sure they know that it was at the cost of removing or dropping the words relating to SRHR, the sexual rights and the sexual and reproductive rights of women. That had to be dropped. So this is the cost of having these rights, and this is how the UN is being effective. So, and also I want to raise an issue which has always bothered me. Since Shobhaji mentioned that I go to CSW, yes, I have been going to the Commission on the Status of Women since 1994 without a break during COVID, of course, online, but I've been there in person doing advocacy for all this. But the question that has been, there, what is the outcome of the CSW? At the end of the CSW, we have what we call as agreed conclusions. And in between every 4 years, we have a political declaration. So, what is the value of these agreed conclusions? The states agree to that, but have we ever bothered to see that have these been implemented in the country? What value is that? Nobody has ever. What only we find is that when next the issue comes, they say resolution so and so, agreed conclusion so and so, so and so, and nobody reports on what is the ground reality back home. Have these countries implemented those agreed conclusions which they agree to at the CSW? So, what value is also, you know, has the agreements like Sustainable Development Goals or the Pact of Future? Now, Sustainable Development Goals as much talks about violence against women, it talks about gender equality, it talks about rights of the women, and also the most important is the phrase "no one shall be left behind." Now, can you think of a person not being left behind if that person is not free from violence, whether it's economic violence or it is social violence, it is violence in the area of health, violence in the area of education, violence in and denial of anything. So can the SDGs and be, realized? Can you realize the goal that no one shall be left behind? So you have the Pact of Future now, where we had to find and to get, the words included. And so is financing for development. I know all those friends. This time I could not be present over there. How much difficulty they had in getting some words included over there. So the question that arises again, we have the Security Council Resolution 1325, right, which talks about conflict situation. But whatever is happening, are we able to, is the UN able to take any action over there? Are we hopeful that SDGs, now, already the Secretary General has said not before 2064. And I'm reminded of when the SDGs were adopted, there was a parallel event organized by the United UN Women and the People's Republic of China, from promises to commitments. That was the title of that, from promises to commitments. And the banner outside had two catchy phrases. And these catchy phrases were 50-50 by 2030, and the other was patriarchy shall come to an end by 2030. Now, do we see that? If it is to come, and there will not be any talk of violence against women, there will not be the need of the 16 days of activism for that. So where is it all said and done? Now the you know still we have to continue the our and of course the financial crunch. The last point on this score that I want to make is the financial crunch that the United Nations is facing. So if the states are serious about giving the rights to the people, giving the rights to the women, making the society free of violence for that matter, so that they can realize equality, they can realize the human rights, then where are the finances? So financial crunch is there, and as of now, we learn it may not happen, and we pray that it doesn't happen. There is a move, to merge UNFPA with the UN Women. Now, UNFPA, on the one hand, you are talking about that the SRHR, needs to be dropped, gender needs to be dropped, and again, Shobha, I want to take a personal second to share with you that in 2000, when the special session of the General Assembly was, held, so, it was Beijing plus 5, the special General Assembly session. And at that time, those were the time where civil society still was, given some space. So they invited 5 representatives from different regions of the world to address the General Assembly. And I remember still, I was at that time the chair of Asia Pacific Women's Watch, and I had the privilege to address the UN General Assembly. So as I was sitting and waiting for my chance to, next person sitting to me was Nafisa Sadiq. Nafisa Sadek, and she was in tears. I said, "How come, ma'am, you are having tears?" And she said, "I'm quote unquote, this is oral history that I'm sharing with you." And she said, "I am worried that this whole SRHR, progress that we have made during this, convention on population and development, the progress we have made, I am afraid this may be washed off." Right? So this she said in the year 2000. And now I realize that it did not take more than 25 years just in CSW this year, SRHR was dropped just for the sake of the word gender. So here we are, the kind of problem that we are facing, the kind of more we have to. So they are saying merge UNFPA. I mean, this is one of the proposals. Merge UNFPA and UN Women. Financial crunch. Now, if the very basis premise and one of the strongest argument of UNFPA is for SHRA, right? So if they merge, what will happen to the agenda of women, including the agenda that we are talking about? This all really upsets you, but even that and the whole that background, I would still say that accountability is the key. Accountability of the UN bodies, accountability of the state governments, accountability of the civil society, because engagement of civil society, we can't just wash our hands off, right? Okay, this is done, nothing is happening, so why should I? I mean, a person like me now thinks, why should I go to the CSW? But I think it is, when we are talking of intergenerational move, particularly this young generation that is coming up, they should know what all we have gone through. And that's why I'm
Yes.
sharing about
Yeah.
Nafisa Sadek's, this thing. And so we have to engage the civil society, right? Both men and women, both boys and girls, all have to be on the platform, because equality is not an issue only for women. Violence free society is not only an issue for women and girls, it is a societal issue. And so we have to together. And so this activism of 16 days to me still matters, because silence would sustain violence, right? So if we become silent, oh, nothing is happening, so let's be, no, silence would sustain violence, and we need to keep the issue alive. We have to see that the campaign is led, not merely by passage of laws. You already quoted, there is a law, there are laws, but they are not implemented. So we have to see to it that there are laws, whether it's domestic violence or it is sexual harassment or whatever it is, and the global conversation. Now, this is very, very important. And in that context, your whole meeting becomes very relevant, that this global conversation on harassment, on violence, and particularly conflict situations. We know what is happening the world over. We have to be careful. What are these institutions doing, or what value do they have? On the one side, they say this is genocide, right? The International Court of Justice, the Rome Statute, all they talk about that. But when somebody is declared as a person who has committed genocide, they're after what? Right? The UN is silent, these institutions are silent, but the civil society cannot be silent, and we have to continue to raise our voice. So, global conversation on issues of harassment, violence in conflict situation, digital violence, right? This is, of course, a very, very serious issue, and in the times to come, the AI is further going to deteriorate the situation. So, we demand zero tolerance for violence against women, both in policy and practice. We need to have men as allies. We need to have intersectional approach. We need to see to it that the states, don't wash their hands off, right? We create an environment where the state feel this thing. So violence against women is not something where we can say, oh, it is inevitable. No, it is not inevitable. And last but not the least, I would say that, of course, global campaigns are very, very important, right? We must network for that, and we must continue to shift the gear, but the gear also has to be shifted to local campaigns. Local campaigns to end violence against women and girls so as to have a truly accountable world. Accountability from global to local and local to global for a safe, healthy environment for each and every human being on this earth. Thank you very much for giving me the time and opportunity. Thank you.
Thank you very much, Pamji, for being here with us today and filling us with hope, because sometimes I too despair that are we going to achieve something at all at the end of the day. But then again, as we say, we are all sisters, resistors, and persisters in this cause, and it should end with us. All this inequality and inequity should end with us. Thank you very much for being here with us.
Thank you.
I now invite Esther Asuquo, noted gender and peace advocate at the African Girls Empowerment Network. Friends, African Girls Empowerment Network is hosting a special summit on Speak Up and Heal on 10 December to mark Human Rights Day. Now, welcome, Esther. The stage is yours now.
Thank you very much. Good afternoon, everyone, and good morning, wherever you come from. Can you hear me?
Yes, we can hear you, but we cannot see you.
Oh, sorry. Let me open my camera.
Yes, yes,
Okay.
yes, yes. Welcome.
Okay.
Yes.
Thank you very much for having me here. And my special thanks for She and Right for this opportunity to be part of this important conversation. So my name is Esther Asuquo, and I'm a passionate gender and peace advocate dedicated to empowering young women and girls to live free, informed, and self-life. I am currently working with African Girls Empowerment Network. It's a registered frontline civil society organization dedicated to advance sexual and reproductive health and rights of young women and girls. So today I'm going to talk on the HIV, gender GBV, intersection of GBV and HIV. Intersection of GBV and HIV. So when we talk about GBV and HIV is the risk and impact on the women and girls. HIV and GBV create a cycle where GBV increases the risk of HIV transmission infection and also create the risk of violence and discrimination against women and girls. Unequal power, harmful gender norms. GBV increase the risk of HIV infection in many ways. Forced sex and physical trauma, sexual violence, including intimate partner violence, rape and physical trauma, tears. GBV also increase the inability to negotiate safer sex among young women and girls. Unequal power, women lack they lack unwanted to reduce unwanted sex or negotiate consistency use of condom with their partners. They know that even with those that HIV positive, when you're talking about child sexual abuse, girls who are experiencing child sexual abuse are more likely to engage in visual sexual behavior, to engage in adolescent and adulthood, which increase their vulnerability to HIV harmful traditional practice. We have one of the students, when we held a section with them last week, This lady, this girl had been abused for 2 years, and she's unable to even to speak up to tell her father or her mother that she was raped by 24 years old girl, and she was 12 years when she raped. So when we were having a section with them, we talked to them about sexual abuse. She has to boldly come out to tell us that she was raped, and now it has been affecting her a lot, and she has been like having different, any man reaching out to her, she will accept, because she has been trauma. She has been trauma. She has been facing, she has been traumatized. She has been facing a lot of like a lot of what she was not expected. So with this, I think we can be able to to address this, the impact of intersection of GBV and HIV. Number one, we have barriers to healthcare, fear of violence, stigma and discrimination. Prevention, it prevents women and girls from accessing their HIV testing, contraceptive. Unwanted pregnancy, girls could drop out. Counseling, prevention of mother-to-child transmission, and more among women and girls. Contraceptive, we are talking about contraceptive. If a woman has been in an abusive home, there is no way for her to say, okay, I want to go for contraceptive. I want to make use of contraceptive so that I will prevent myself from unwanted pregnancy. I remember a woman said, crying to us when we went outside for outreach. A woman ran to us and was crying that she has two children and different father. And she was actually trying to cater for those children, to send those children to school. A man actually walked to her and begged her, that told her to herself that she will assist her to take good care of the children. But before you realize, after the man has already given her the pregnancy, has impregnated her, the man ran away. And she also been facing trauma. She has been traumatized. She has been crying out, how and what can she do to prevent herself from this unwanted pregnancy that she has been looking for many ways. She went for hospital, nobody responding to her. So we have to call her and tell her that there is nothing we can do. The only thing the assistant we have, we release to her. We advise her to come for counseling. We caution her, we advise her, and thank God she has been safe today. So economic consequences, GBV and HIV can lead to loss of income, employment, discrimination, financial dependence, and vulnerability, and making it difficult for women to leave abusive home. A lot of women are there staying in abusive home, and they are, like one of them was sharing with us that she usually worked before. Then her husband been seeing her that she's sleeping with her boss. That is why she cannot go anywhere, that she can't work any longer. She has to be staying at home, and she'll be staying at home without going anywhere. And her husband now be just using her badly, talking to her, using her, beating her up. And she was running to us and told us, what can she do? That she has tired with this abusing home, that she can't continue again. We'd advise her that she has to create a safe space for herself. That is where Edge Network is here to help. You need to speak out. For you not dying in silence, you have to speak out. And that is why I thank God today she has been healed. She has to leave that abusing home and stay focused and work. Then we also have psychological and social trauma. A lot of survivors are experiencing significant psychological trauma, including depression, mental health issues, which can affect them over their overall well-being. Depression, all women that is going to GBV, they are facing depression, trauma. So that is why now, how can we address this kind of GBV and HIV? So we are now called on government to take action, NGOs and other organizations to take action by organizing a comprehensive, integrated approaches that challenge gender inequality, promote women empowerment, and strengthen the legal protection, and integrate GBV services with HIV care and prevention program for women and girls, so that we can be able to address the GBV and the HIV that affecting a lot of women that is facing GBV, HIV. They cannot be able to speak out even when their partner is forcing them to have sex with them. They cannot, because they think that if they talk, their partner will even landed them another slap. Like a woman was saying, if her husband wants to have an affair with her, want to have sex with her, he must first and foremost beat her up, make sure she's weak before the man can use her. And those kind of relationship is no good. So that's why we call all women and girls to speak up. When one they speak up, they should not be terrified. When one they speak up, they will be healing from all they will see solution, because nobody knows what you are passing through in your houses. Nobody knows what we are going through in your various houses until when you come out and speak out that this is what I have been going to. Like a lot of women that are running after us and tell us this is their condition. And thank God, all of them, there's a testimony that they are healing. There's healing. They are healing from that depression, that trauma. There is one of them that we even directed her to psychiatric hospital last week, and she has been calling for testimony that she has been okay, because she was traumatized by her husband, beating her up because of sex, beating her up, no food, and she's the one caring for the house. That causing her more depression. So if you come out and speak out as a young woman and girls, definitely you will surely get healing. So thank you very much for having me here. And also, I just want to use this opportunity to invite you to Speak Up and Heal Summit on the 10th of December, coming up on Wednesday. Thank you very much, Shehan Wright, for having me here.
Thank you, Esther. Thank you for connecting the dots between HIV and sexual violence, because health inequity abets gender-based violence. And also, as you said, speak up, because speaking up is so important. As Pam Rajput also said, that silence sustains violence. So we do not have to remain silent. Thank you for being with us today. Our next speaker is Dr. Huda Syyed, founder of Sahara Sisters Collective and part of Asian Network to End Female Genital Mutilation and Cutting, or FGMC as we call it. When we speak about violence and human rights violations, female genital mutilation or cutting is perhaps amongst the most heinous crimes. We must end such practices everywhere if we are to keep the promises of gender equality and human rights. Welcome, Huda.
Thank you so much, Shobha. Hi, everyone, and thank you for sharing your time and the space, and also Shobha and Professor Dr. Pam Rajput and also Esther. I'm so grateful to be in this space with all of you and grateful for everyone who's attended here. So I will start off bringing in a researcher voice and a human voice as well. My name is Huda, and I'm a researcher. I'm based in Melbourne, Australia. I also teach at the university and do advocacy on gender-based violence, community issues, more specifically culturally and linguistically diverse communities. And I also do some mentoring when it comes to international students, because that's something very close to my heart, especially women. Most of my research, including my PhD, focused on the practice of female genital cutting, and more specifically within South Asia and using a Pakistani lens. The UNICEF report update in 2024 showed that over 230 million girls and women worldwide had undergone FGC, female genital cutting. Now, might I add that there are various terminologies used for the practice and for various reasons as well. Female genital cutting, I found it to be something that allowed me to have conversations with women and speak to communities as well, which is why I chose to use this word within my research as well, and generally. So over 80 million girls and women in Asia underwent female genital cutting when we look at the statistics and updates in 2024. Now, this was a 15% increase compared to 8 years ago. So that shows an increase in the practice. And from what we understand, South Asia, including other parts of Asia, have lack of data, especially when compared to other countries within Africa. So there is a need for data, not only data, but also dialogue and conversation in spaces like this. Now, I'll come back to the main question specifically for this talk, for this panel, for the reason why we're all here today. Despite some progress, global change is far too slow, and it's quite difficult to meet 2030, the Sustainable Development Goal target of ending female genital cutting by the year 2030. Now, if we calculate, we're currently in 2025, so that's quite a tight deadline to meet, which is why I think having conversations like this and then actioning on them is very important. And this goes back to everything that Professor Dr. Pam Rajput mentioned as well. So we need fast progress, but we also need caring progress, which I will come to later on. Sustainable development cannot occur when half the population is harmed, silenced, or excluded. Development justice demands that policies center women's safety, agency, and bodily integrity. FGM or FGC is known as a human rights violation by international organizations, by the World Health Organization. Now, FGC comes in various forms, and 4 forms, so to say. And in a joint statement organization, which also included the Asian Network to End FGC, there was a condemnation of the medicalization of FGC in all forms, and there was a reinforcement of ethics of do no harm. FGC, it comprises, compromises bodily autonomy, and I found this to be especially something that really stood out in my research as well. Young girls are taken into the practice to be cut without prior knowledge or understanding. And sometimes they're told that they're going to another place, whereas they're actually being taken to be cut. Now, female genital cutting, while traditional cutting existed where young girls were taken to traditional cutters, now there is a medicalized form that is emerging in parts of Asia and even in Pakistan. The reason why we're here today is because we have not held systems accountable, and we have tried, but we need to keep trying. And I think Professor Dr. Pam Rajput's talk also gave me that fervor and that sort of passion that we all need, and that commitment, because it can get really demoralizing for everyone within the advocacy space. So we're here to hold systems, institutions, and even states accountable for gendered harm. Now, coming to why we're still here. Why are we still talking about female genital cutting when Sustainable Development Goal number 5 says to end the practice by 2030? There is lack of data in Asia as a region. While there are some statistics that can be found in specific countries and small-scale studies, such as PhD thesis or organizations releasing reports as well, there is a need for more national data. And for that to happen, governments and institutions need to be more involved. But that needs to be done using a culturally sensitive lens as well that also involves communities rather than excludes communities. Countries like Pakistan, they have no national data on FGC. So sociocultural notions of shame, secrecy, and silence, which I think has been a theme within this panel, and something that is attached to girls and women's bodies, and it can lead to further silencing and perpetuation of various gendered customs, including female genital cutting, including gender-based violence or violence against women of different types. So I touch on this topic specifically with regard to data and dialogue in Pakistan in my PhD thesis, and I discussed this within a paper which was called Lack of Data and Dialogue on Female Genital Mutilation in Pakistan. And I build on that notion that culturally sensitive research needs to be done where communities are involved within the solutions. There is some progress, and there are many organizations where a united front has been built to challenge gender-based violence, violence against women, and also to end the practice of FGC. Now, this is important to note, as I mentioned, because of goal number 5 that we're supposed to reach by the year 2030. Now, in my work, I reiterate that to gather stories or data, it is important to also bring in a contextual lens and some level of cultural sensitivity to communicate with communities and not villainize them. When we villainize communities, communities are quiet, communities are silenced. And instead of working together, we just work apart and further exclude communities. So it's important for all of us at this time to come together, to work together, to hold structures and customs and communities together with them, hold these governments also accountable, but not in a harmful way or a villainizing way, but rather in a caring approach that involves communities. It is not only FGC, but many other practices, and I think where we need to approach communities with care. We need to approach communities with a trauma-informed lens as well. And this could also help with dismantling shame, dismantling secrecy, and also allow communities to share their voices with willingness and join us all in this advocacy to stop gendered customs. And the communities are already doing a lot of work. Women are already involved as well, might I say. So creating safe spaces is important, especially about FGC, so that we can collaboratively come up with solutions. And some care for political and religious precarities must also be considered to ensure that communities are not harmed or targeted in the process. So this way, we don't invisibilize gendered customs like female genital cutting, but we provide visibility, and then we provide awareness, and gradually we can move towards accountability as well. So I think it's important, especially for researchers as well, to have culturally grounded methodologies where they are also caring towards communities and culturally sensitive, and solutions are collaborated and co-designed together. And this provides not only visibility, but also it helps challenge these notions of medicalization, and that medicalization of female genital cutting, so to say, prevents harm. It's seen as a harm reduction strategy for continuing the practice. So we need to also address this, which has been mentioned in the joint statement. So ending female genital cutting in Asia and globally, it's not a marginal issue. It is central to gender and development justice, and it's central to bodily autonomy, to public health, to equality, to human rights, to children's rights, to girl-child rights. And accountability means, yes, naming the harm, having conversations, but also having them in ways that do not harm communities. Also, funding is an issue. I think that Professor Dr. Pam Rajput already spoke about, and there needs to be protection and safe spaces for survivors as well. And systems need to be challenged. Patriarchal notions of women's bodies, which are shaped into shame and secrecy, those need to be challenged and dismantled. And I'm not sure about whether we're over time or not, Shobha.
Yes,
so
we are over time, but yes.
Okay, I want to close by honoring the women and the community that I actually spoke to in my research. An amazing community, incredible women, and women who shared their stories and trusted me with them. And I hope that change, even regarding female genital cutting, it comes with care for the community, collaboration. Thank you so much.
Thank you, Huda. Thank you very much. First, on talking about medicalization of FGM and also community involvement, that is very necessary, because we are all the time talking of people-centered approaches, and we cannot leave the community behind in involving them in a positive way. Thank you very much for focusing on this very, very important issue. Thank you. Our next speaker is Albertina Nyatsi, founder director of Positive Women Together in Action in Eswatini. Albertina led CNS at the largest AIDS and STIs conference in Africa, ICASA 2025. Welcome, Albertina. Over to you now.
Hello.
Hello. Yes, we can see you now.
Hello.
Yes.
Okay.
Yes.
Thank you so much, Shobha. My name is Albertina, and I am at the ICASA conference. ICASA is a gathering of African leaders, activists, researchers, and implementers, where they come together to discuss and share innovations, strategies, and partnerships across Africa. There is a lot that is happening in ICASA. We have the community village, where communities come together and they do sessions and also network. We have different sessions at the community village, where sessions like human rights are done, gender-based violence, ASD, and other topics are discussed at the community village. And then we also have scientific programs where we see researchers showcasing new research, such as the long-acting PrEP. There's been discussion along lenacapavir, which is a long-acting injectable that is being used to prevent HIV, and it is an injection that you take twice a year to prevent HIV. And we've also heard that there are countries like Eswatini and other countries are already rolling out this type of long-acting prevention. And then also, there's also lots of researches that are being discussed at the scientific by the scientific people and the researchers. And then we also have in the community village, we also have what we call the community, the women's networking zone, where issues that pertains to women are discussed. Issues that includes the feminism and other issues. There's also, if you go, if you're here, I was going to show you on my right here, we have the exhibition where the latest innovations are being exhibited. You see lots of new prevention and management innovations and machines that are there. I've seen lots of tests, new innovative tests having been being displayed there. And amongst them, I've seen there's also another one for TB, there's others for testing hepatitis, and lots of other diseases. It shows that Africa is coming together to innovate and ensure that HIV, TB, and malaria are managed, and they are managed, and they are going to be eradicated. And okay, with this conference, we are expecting that it is going to come out with maybe some of the outcomes that are going to include the political commitment to ending TB, HIV, and malaria. And also, we expect that maybe we're going to come out with more sustainable community-driven systems, community and health-driven systems in Africa. And also, we're hoping that there's going to be stronger partnerships among donors, communities, and the researchers, where they will go back and continue to collaborate and do more research. Thank you so much, Shoba.
Thank you. Thank you very much, Albertina. And thank you for giving us a glimpse of what is happening where you are right now, ICASA, that is in Ghana. We are happy to have with us today a youth feminist, Alana France, who is studying for her master's in women's health. Welcome, Alana. Can you please briefly share your reflections on gender-based violence?
Yes, thank you so much, Shoba, and everyone for having me today. I'm really excited to speak. I just have a few brief slides, so I'm going to share them.
Okay.
Share them now. Can you all see the slides there?
Yes, we can.
Yeah. Perfect. Okay, great. So hi, everyone. Thanks so much for having me. As was said, I'm a student, so I'm new to this space, and I'm really excited to both contribute and learn from all of you today. I'm studying women's health in London at the moment, and I'm really proud to represent young women in this forum. Today, I'm looking forward to sharing my reflections from two incredible conferences I recently attended. So to begin, last week I recently attended the All In Initiative launch, a global collaboration focused on ending gender-based violence. The organizations that hosted the initiative included the Ford Foundation, the Equality Institute, the UK government, and the Wellspring Philanthropic Fund. Bringing leaders from around the world, such as Tarana Burke, who founded the Me Too movement, and Charlotte Bunch, the initiative aims to drive leadership, accountability, and support effective existing solutions to reduce and ultimately end GBV. Many of you today have spoken about the statistics, but the one that alarms me the most as a young woman is that 1 in 3 women and girls experience violence in their lifetime. So, what were the key takeaways from this conference? So, one of the central messages from the launch was that violence is not inevitable and it is preventable. We already know what works. The UK-funded What Works programme has demonstrated reductions in GBV of up to 50% within just 2 to 3 years across 15 low and middle income countries. Another takeaway was the importance of engaging high-profile professional athletes to reach men and boys specifically. So athletes like New Zealand cricketer Ross Taylor, who was at the launch, serve as role models who can challenge harmful norms and promote positive masculinity, which I think is really important in this space. The hope is that the All-In logo will appear on sportswear at major global events like the Olympics, using sports as a platform for change, particularly important given that major sporting events often coincide with spikes in violence against women. A recurring theme was that human impact must always take priority over purely economic framing. While funders do often require cost-benefit justification, it's critical to center the lives and experiences of survivors specifically. Many estimates already put the global costs of violence against women at around 1.5 trillion US dollars per year. However, speakers at the launch noted that the real figure is likely even higher. The link between climate change and GBV was also highlighted. Unsurprisingly, climate impacts are not gender neutral. Extreme weather events, food and economic insecurity, and displacement all increase women's vulnerability to violence. For example, research shows that every 1 degree Celsius rise in global temperature is associated with a 4.7% increase in intimate partner violence. So if global temperatures increase 1.5 degrees Celsius by the time I'm 30, so in 2032, this would correspond to an estimated 7% increase in intimate partner violence globally. Speakers really emphasized the need for collaborative approaches. Health, education, infrastructure, transport, justice, and community systems all working together. Survivor and community-led initiatives must be at the center. Changing social norms takes time, but it works. Even shifting language can make a difference. The move from early marriage to child marriage contributed significant reductions globally. And then moving on, I also attended the Irish Global Health Network conference, Empowering Women for a Healthier Europe. It was fascinating to explore women's health through a European lens. One of the outcomes of the conference is a policy brief outlining key recommendations for women's health in Europe. Youth was one of the 4 priorities of this conference, and I was one of the youth representatives. So what were my key takeaways from this conference? So Alva Smith, the keynote speaker, highlighted the state of GBV in Ireland. Since 1996, 276 femicides have been recorded, most committed by current or former partners. Domestic violence is rising, with Women's Aid reporting a 45% increase in domestic abuse calls in the past 4 years. The conference also explored ethnic minority health gaps. Roma and traveller communities, who are highly stigmatized Irish ethnic minorities who face significant barriers to healthcare access. Simple tools like culturally adapted patient information leaflets can make a real difference. But long-term solutions include training members of these communities as advocates and health professionals, an approach that's already showing huge success. Jennifer Okeke spoke powerfully about how women's health is deeply tied to anti-trafficking efforts and rights-based advocacy for sex workers. She emphasized how narrative research specifically, centering women's own experiences, can shape stronger, more informed policy. I also had the chance to hear from Abigail Erickson, Chief at UN Trust Fund to End Violence Against Women. She shared shocking statistics, such as the fact that 1 in 4 women in the US experience non-consensual strangulation before the age of 18. Also highlighted was the UK's recent progress in banning pornography that includes strangulation, an important step in acknowledging the harmful influence of online content in normalizing violence. Stronger regulation of violent online material is urgently needed. Another topic was women's cardiovascular health. So from a global perspective, really recognizing the differences in how heart attacks present in women is essential. Many women experience symptoms like fatigue, nausea, shortness of breath, or jaw and back pain, rather than the classic chest pain seen more often in men. Increasing public awareness and improving clinician education are key to reducing misdiagnosis and improving outcomes among all women. And so, across all these conferences, one message stood out to me. Advancing women's health goes far beyond clinical care. It's shaped by social conditions, cultural norms, and systemic barriers that determine who is protected, who is heard, and who receives care. True progress requires evidence-based practice, survivor and community-led approaches, and a global commitment to equity, safety, and dignity. Paramount to change is the meaningful engagement of young people. As a student in this field, I'm really grateful to learn from the leaders doing this work and hope to play even a small part in the change ahead. Thanks so much for listening, everyone.
Thank you, Alana. Thanks for sharing your reflections from the two conferences, and all force to you as you embark on your journey to end gender inequity in health. Thank you. We now move to a special report launch which marks 25 years of inspiring work on HIV of Humana People to People India. Humana began working on HIV in 2001 when free rollout of life-saving antiretroviral therapy had not begun in India. A lot of positive changes have shaped India's response to HIV since then. Thank you, Humana, for your contribution. Let me now invite Lisbeth Arup, Head of Program Development at Humana People to People India, to launch the report. Over to you, Lisbeth.
Thank you very much, and good afternoon and good evening and good morning if there are somebody who's in the very early morning over there. Let me share the front page of our report that tells about 25 years of joining forces with all other people on the globe who has been fighting to get first control and then now to end HIV. And we are very thankful that we could use this occasion in the global campaign to end violence against gender, and also this important forum to launch our report, which can also be found online if any of you want to study it more. It talks about our work in the last 25 years in HIV and AIDS, which is also very related to ending stigma and discrimination and also direct physical and mental violence. So now we have a whole team of us talking about these things. We will start with Dr. Sugata, who has contributed immensely to the report, and then different colleagues who have been working in the field. And just shortly about Humana People to People India, it's an development organization. We are 27 years old in total, so you can hear that we have worked with HIV from the very beginning almost. And apart from that, we also work in the field of livelihood, environment, education, and other areas of health. So with these few words, and then thank you very much for the opportunity, I'll hand over to my colleagues.
Thank you, Lisbeth. Thank you. So I would now request Dr. Sugata Mukhopadhyay to briefly share the main points of the report. Dr. Sugata.
Okay, I am audible and visible?
Yes, yes.
Okay. Good morning, good afternoon, good evening, depending on wherever you are. So myself, Dr. Sugata Mukhopadhyay, I am a medical doctor and public health specialist. I am associated with Humana People to People India as the health advisor for the last 14 years, and I am presently based at Delhi, India. Thank you for giving me the opportunity to speak about Humana's overall activities in HIV and tuberculosis. In the next 5 minutes, I will brief you about what Humana has contributed to the HIV and TB programs of India. I will start with the HIV program first. Humana was registered in India in 1998 and launched its first HIV project in 2001. Since then till now, for the last 25 years, Humana had implemented 15 HIV projects, out of which 8 projects with the National AIDS Control Program of India and 7 with various other donor partners like UNAIDS, UNICEF, Plan India, and Johnson & Johnson. Presently, Humana has been implementing 4 HIV projects, being one of the close partners of the country's National AIDS Control Program. The states of India like Bihar, Delhi, Haryana, Rajasthan, Uttar Pradesh, and Telangana remain the key implementation sites of Humana's HIV projects. We mostly worked with the key population like female sex workers, men who have sex with men, members of transgender communities, people who inject drugs, migratory population, truck drivers, young people, street children, and pregnant women. At present, Humana is highly committed to contribute towards global and Indian initiative of HIV and AIDS elimination and reach the 3 zero targets, namely zero new infection, zero death, and zero discrimination in its HIV projects. We are already showing promising results with high quality performances in our HIV projects, which we will communicate and disseminate shortly. As of now, you will find detailed talk about Humana's 25 years long journey to tackle HIV epidemic in India in our reflection document, including some interesting case stories from the field, which is launched today. Humana is equally active in tuberculosis sector for the last 11 years, already implemented 8 projects in states like Delhi, Maharashtra, Telangana, and West Bengal, in partnership with various partners like Stop TB Partnership, US government, Azim Premji Philanthropist Initiative, and TB Association of India. Humana's key focus in TB was to reduce disease burden among very high risk and difficult to reach urban-based key and vulnerable population like unhoused people, migratory people, and those living in unauthorized slums and informal settlements in the large metropolitan cities of India. Those people often get lost from the services of the country's national TB elimination program due to their high mobility, poor access to services, absence of citizenship documents, and overall sheer poverty. Between 2014 and 2025, Humana has screened more than 4 million of such high-risk people and helped to detect more than 7,000 people with tuberculosis from them. Humana has also demonstrated effective partnership with the corporate social responsibility or CSR partners in TB and helped to detect large number of people with TB from the informal laborers and factory workers. Humana linked all the people detected with TB to the treatment and other socio-economic services of the National TB Elimination Program of the country and helped them to complete their treatment successfully with continuous monitoring, tracking, and treatment adherence support. We also demonstrated effective collaborative initiatives between our HIV and TB projects and help the high-risk groups of HIV projects and people living with HIV to access the TB screening, diagnostic, treatment, and prevention services of the National TB Elimination Program on regular interval. Humana addressed critical structural issues regularly in its HIV, TB, and other health and development projects, which often create hindrances to service utilization, like stigma, discrimination, gender inequity, violation of human rights, gender-based violence, and social exclusion. My colleagues of Humana will describe them in detail from their field-level experiences in the subsequent speeches. Thank you so much.
Thank you, Sugata. We have with us Ramphul Sharma, who will briefly share, very briefly, Ramphul, initiatives to address violence among sex workers and HIV affected women and girls. Over to you, Ramphul.
Hello.
Hello.
Good afternoon. Good evening.
Yes, we can hear you clearly. Please continue.
Yes. I am Ramphul Sharma from Humana People to People India as a project leader. Now I am sharing my previous experience working with community life changes in Delhi or Mumbai. In Delhi, female sex workers facing multi-interaction vulnerability due to gender equality, stigma and criminalization in the cities. Through the HOPE project, targeted intervention project with Delhi State AIDS Control Society partnership, we identified the 3,200 female sex workers in Delhi that PPI has been implemented since 2008 with the purpose of prevention of HIV transmission and sexual transmission infection, mobilization through the behavior change communication in their life, and inspired to other new female sex workers in their life as well as society. During this project, we found 40 plus HIV positive and linked to ART center, and they are on ART treatment as well being and on their life to families. The violence is not only physical but is also included sexual, emotion, economics, and structural violence, client violence, physical assault, rape, refusal to pay condom refuse, and other things too. Also, their intimate partner, violence, emotion, physically and economic abuse from partners. The police or authority violence, harassment, exploiting, confusion on condom, arresting. The community level violence, stigma drive attacks, discrimination and victim structural violence. Law, policies and social norms, the increasing vulnerabilities. Through this project awareness, we advocacy to the police station staff, police house officers for the female sex worker lives, sharing the struggle in their family. So how we can run to the family expenses for the sex work and live their children for education and ration, food, etc. After our advocacy to SHO did not harassmenting them to the female sex worker, but understood the FSW reason for this involvement of sex work. I was leading the project called Women Access to Education and Livelihood Opportunity in Mumbai. There are two districts, Thane and Mumbai. Partnership UN Women. We enrolled the 500 plus HIV infected, affected, and vulnerable essential group and young women for education and skill training for supporting their future education and job liability opportunity. During this project, we identify HIV infected, affected, and vulnerable essential group and young women for education skill training, provided job placement, Haldiram restaurant, McDonald's, and women there start their own business, tailoring, beauty parlor, and other food restaurant. This project was really useful for the young women affected by HIV and other, and we understood the importance of skill training and education for overcoming violence, stigma, and discrimination. It give to women Invest confidence to complete and education. Some hard previous give up to the earn one money own money. It is a victory and should not to be underestimated. It's good for young women and girls for earn their own self and their family and create their living life influence in their society for as an a good example. Thanks.
Thank you, Rampul. Thank you. We also have with us Ravinder Kumar, who leads an inspiring team at Humana People to People India, working with homeless and migrant women and girls. Ravinder, can you please tell us briefly about your project Suite, the
Okay.
High Impact Intervention Suite? Yes.
Thank you so much. By working with the Humana People to People, I have 20 years. I started working last 20 years, and I have working with the HIV/AIDS project, and also I'm working 15 years in with homeless community, especially the homeless community, urban marginalized community. And I have previously I was leading the SWEET project, Street Women Empowered and Engaged to Stop TB. And one thing I learned from this, I understand the where women stand last, violence stand first. And I want to speak not from the office or report, but from the pavement, the night shelter, the underpass, and the broken corner of the city where the homeless women are living, and we are dealing with day-to-day life. Because when you work with the homeless woman, you realize something very quickly. Their biggest enemy is not poverty, it is violence. And right to next, it stands stigma. Especially when while the TB and HIV disease with it associated with that, and which curses dignity silently. The reality of homeless women, violence as daily weather. For homeless women, violence is not an incident. It's a routine, almost like weather. It's come in the night. It follow them in the shelter. It hides inside the system that are supported to protect them. And in this life of fear, TB become not just an illness but a curse. Women tell us टीबी हो गया है तो शेल्टर वाले दूर हो जाते हैं, दूर हो गए, उन्होंने मुंह फेर लिया। लोग मुंह फेर लेते हैं जैसे हम कोई पाप लेकर घूम रहे हैं। ठीक है, टीबी स्टिग्मा बिकम ए न्यू टाइप ऑफ वायलेंस, one that pushes women deeper into the isolation. TB stigma among the homeless communities. Here the hard truth we saw daily life in that project. Women hide TB symptoms because they fear being thrown out of the shelter. They avoid screening because they fear losing daily wages or safety spots where they're sleeping. Many think TB is punishment of God, or it's very dirty, or contagious forever. And staff in the shelter themselves want to isolate or remove, especially when the woman with the TB or HIV. Physically weakness invites some more abuse, more control, more harassment. And the TB and gender-based violence feed each other. A sick woman become easier target. A frightened woman avoid care. A woman without support remains invisible. And what we did in the SWEET project, we knew we couldn't fight TB without fighting violence, and we couldn't fight violence without building trust. So we started small one-to-one woman on shelter, one conversation and a time, and we formed a Saheli support group to fight and stop the violence against women, gender-based violence, especially in the homeless and night shelters. We create circle where the women sat together without fear. Here they couldn't talk about the TB and also about the beating by the family, by the caretaker or the husband, and threats, humiliation. Slowly, silence started melting. When we start Saidi group meetings, the silence start melting. Then women start speaking up, sharing their violence, how they are facing, and we also plan how to deal with it. So we unite together, we give them information about their right based, introduce with them the system about the legal support system like DALSA, Delhi Legal Service Authority. We involve also some police guys, some volunteers, some organizations who can protect their rights and give their strengths. So also we start meeting with the departments to provide the treatment with dignity and care with them very honorable manners and not by the discriminating manners. On-site TB screen referrals, we brought health camps and symptom screening right into the shelter because expecting homeless, especially homeless sick women, to travel to the hospital is like expecting birds to walk. Stigma reducing session for the shelter staff. We also we discuss with the shelter staff and who are caregivers in the night shelters to respect the women's. If the woman especially sick facing TB, you need to extra care and treatment. So how this we come, and we create the crisis support for the GB's gender-based violence services. When a woman faced violence, we didn't just document it. We stood with her. We linked her to the police system with DALSA, Delhi Legal Service Authority. We negotiated with the shelter management. We make sure it wasn't pushed out, ensuring access to the welfare and healthcare services. And also, we invite the other society or interact with them, see the challenges of the homeless women, and come forward to support them. This is how we serve with the 6,000 women in the night in the Delhi, and I have many stories to tell, but for the short period.
Yes.
Yes.
Thank you very much. Thank you very much, Ravinder. We also have another stalwart from Humana today with us, Jahangir Alam. Jahangir, please be brief in what you have to say. Thank you.
Yes, so can you please confirm I am audible and
Yes,
visible
you are.
also?
Yes, audible and
Thank you.
visible both. Yes.
Thank you,
Yeah.
thank you, thank you. So good morning, good afternoon, and good evening. My name is Jahangir Alam. I have been engaged in the implementation of HIV and TB projects, including addressing associated stigma and discrimination for the past 14 years with Humana People to People India. Today, I will talk about how correct information and overcoming stigma and discrimination can help us in ending both HIV and TB, as this is also a form of violence. We all know that TB and HIV are not just medical conditions, they affect people's lives, families, confidence, and their dignity. Many people hesitate to talk about these diseases because they fear being judged or isolated. This fear is more harmful than the disease itself. But the good news is that both TB and HIV they can be treated, managed, and even prevented if people come forward without fear. And that can happen only when we fight stigma with facts. So correct information is our strongest tool. When people know that TB is curable, when they know that HIV treatment allows a person to live a healthy life and long life, when they understand that disease do not spread by sharing foods, by talking, or by simply daily contact, then the fear disappears and the courage takes its place. Information brings awareness, and the awareness brings actions to make healthier communities. Now, I will share a story of a child living with HIV, where we can see how lacking correct information and fear of judgment or isolation impacts people's lives and becoming barriers in ending both TB and HIV. So 2 months ago, I have visited one of our HIV project in Lucknow with the CNS team, and thanks to Sobha ma'am and Bobby for covering this story, which I am going to tell in the field. Yeah. So during our field visit, we met a 4-year-old orphan child living with HIV in a village near Lucknow, Uttar Pradesh. And he's currently living with his grandparents and other family members like uncle and aunties. So from now, I will call that child Baba. So this is the changed name, but I will call him as Baba. So Baba did not get institutional delivery, but was delivered at home with the support of traditionally midwife. So in India, we call Daya. At village level, there are some midwives, traditionally midwives, we call Daya in Hindi. Soon after his birth, he lost both his parents one by one. He was taken care by his grandmother and other family members. His parents had not disclosed their HIV status to other family members. His grandmother and other family members were initially not aware of his health, about his HIV status. Baba's father was a migrant worker in Mumbai, where he met and fell in love with his mother. They got married, and after some time, they both began experiencing health problems. They were later diagnosed as HIV positive in Mumbai and received antiretroviral therapy till they discontinued. When their health conditions get worse, they migrated from Mumbai to Delhi and finally returned to their hometown in Lucknow, where Baba was born soon after. Since birth, Baba had chronic health problems. During a routine door-to-door health awareness and screening visit, Sarojini, she is one of our field officer in our HIV project. So he came in contact with Baba grandparents. After seeing Baba's ill health, she took them to a local government doctor who advised them to get test for HIV and TB at the government-run hospital, which was 30 kilometers far from their home. The test revealed that he was positive for HIV and negative for TB. That is how Baba grandparents and the other family members found out about his HIV status. Both Sarojini and government health workers help counsel the family members. Currently, he is in good condition and is taking regular treatment with the support of community health workers of Humana People to People India. So from this story, there are some key learnings, which are: stigma pushes people into silence, but information brings them into care. Stigma stops treatments, but support helps people complete treatment. Stigma divides communities, but awareness brings them together. Last but not the least, if you want to end TB and HIV, we must create an environment where everyone feels safe to seeking testing, treatment, and support without shame, without blame, and without discrimination. Thank you so much, CNS team, for organizing this wonderful event. And on behalf of Humana People to People India, thank you so much.
Thank you very much, Jahangir Bhai, for sharing this on-the-ground story with us. Let us now listen to this video clip from Angel Babirye, an emerging leader of Women Deliver from Uganda. Angel co-founded Us for Girls, a youth-led organization advancing SRHR, menstrual health, and economic empowerment for adolescent girls. She serves on Uganda's National Teenage Pregnancy Think Tank and leads youth advocacy across 16 countries as president of the African Youth and Adolescent Network on Population and Development, East and Southern Africa.
Okay, 1, 2, 3.
Hello, my name is Angel Babirye, an emerging leader from Uganda. I'm the team leader of Us for Girls Foundation and also the president of a regional youth network called African Youth and Adolescent Network on Population and Development, East and Southern Africa, otherwise known as AFRI-ESA. And when it comes to one of the challenges that I think are facing adolescent girls and young women, I think one of the biggest ones is around period poverty and stigma. It's affecting so many girls across the region in that very many of them are actually lacking safe absorbent materials and are thus forced to use unsafe absorbent materials, for example, soil, sand, and in extreme cases, cow dung. These absorbent materials end up, increasing their susceptibility to reproductive tract infections and also to odor. But then we've also seen extreme cases where girls are actually forced to have transactional sex just so that they can afford pads. And that also increases the susceptibility to HIV, teenage pregnancies, and STIs. But it doesn't stop there. The fact that we cannot openly talk about menstruation ends up affecting so many girls. They think that it's something that should be, hidden and not talked about. It's usually largely shrouded in myths and misconceptions. And today, I'm just calling all of us to really normalize conversations around menstruation. It is normal, and it's very important that girls know that it's something normal and should be talked about. And also, when we are addressing period poverty and stigma, it is very important for us to do so in a comprehensive and holistic way. What am I saying? I'm saying let's not only look at the absorbent materials as the issue. It is so much more than that. It is, do girls have safe spaces to talk about menstruation? It is, do girls have access to clean water to clean their bodies and also their absorbent materials as and when required? It is, do they even have, safe and private facilities so that they're able to change their absorbent materials? Do they have places where they can actually dispose of these used absorbent materials? In a nutshell, let us normalize conversations around menstruation. Let us ensure that we also look at it in a comprehensive and holistic way. Because in Uganda, where I come from, 1 in 4 girls actually drops out once they begin menstruating, and the absenteeism rates triple during their periods. So we can clearly see the ripple effects this has on girls and young women across the region. Let us normalize conversations around menstruation. Let us address it in a comprehensive way so that girls can have safe and dignified lives. Thank you.
Thank you, Angel. Thank you for putting the spotlight on menstrual hygiene and the need of it, which many girls lack, not only in Africa, but in so many other countries. Friends, please mark your calendar for 10 December, which is Human Rights Day, when She and Rights co-host Arrow is launching an important publication, Arrow for Change, on resisting the anti-rights. Details are on your screen. So please join that if you have the time. I would now like to invite Kuljeet Kaur. I spotted her amongst the audience. She is National Secretary General of All India Women's Conference, for her short comments. Kuljeet, you are welcome, please. Yes, Kuljeet, are you there? Okay, I think she has left just now. So we are about to close our session. Sorry, we've already overshot the time. We do not have time for the question and answer session. So those who are interested can please mail their questions to editor@citizen-news.org and we will get you the responses. And before we close this session here, there is the much needed and much awaited announcement regarding Syyed Rights Media Awards 2026. All those who are reporting on issues raised by Syyed Rights sessions from November 2025 to April 2026 can apply for the Syyed Rights Media Awards 2026. The award ceremony would be held at Women Deliver Conference 2026. As you know, the Syyed Rights Media Award ceremony for 2025 was held at the International Conference on Family Planning, or ICFP 2025 in Bogota, Colombia. So just put on your writing hats on and start doing your work. And before we close today, I'm tempted to mention that only last week a bill was introduced in the Indian Parliament to criminalize marital rape and deem it as an act of domestic violence. But whether this much needed bill will be passed remains to be seen. Let us keep our fingers crossed. But it would be a very good move in the right direction if the bill is passed. With this, we come to the close of today's session. And my sincere thanks to each one of you speakers as well as the audience for their stellar participation. Namaste and goodbye till we meet again in 2026. Wishing you all a Merry Christmas and a very Happy New Year in advance. Thank you.